Okay, so good evening to all. I welcome our today's speaker, who is Dr. Vismay Prajapati. He has done his MD in homeopathy in 2016 in Organon of Medicine. He is in academic field since 2017. Sir is saying namaste to all. Then presently he is a PG faculty in Organon of Medicine at CD Achishigar Homeopathic Medical College at Surat, which is in Gujarat. Then he has closely worked with a psychiatrist and sexologist for 2.5 years at Surat. So the persons whom I know since my 5 years of homeopathy, you may be the first person, sir, who has worked for 2.5 years with psychiatrist and sexology, because this is actually the not very known branch. Okay. And then currently he is a PG scholar in fellowship course in homeopathic psychiatry under Maharashtra University of Homeopathic Sciences in Nasik, MHS. He has special interest in learning classical teaching of stalwarts, and he is actively practicing since 2016 at Surat. So I will request sir to start his session. Sir, do you require to share your screen, or you are going to talk only?
Yes, sir. It would be better if I can share my screen.
Okay. So after making your host, you need to admit the participants who are in the waiting room, sir. Please. Okay.
Okay, sir. I will
So
do
I'm
that.
making you host. Okay, your host now, sir.
Thank you, sir. Okay. Is everyone able to see my screen, the
Yes,
slide
sir.
share?
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir.
So, during our undergraduate course, we were taught that Phatak is one of the clinical repertories. So, what I have understood and learned is that Phatak should be used clinically in certain conditions where you need to take pathological rubrics or consider clinical rubrics in totality. So I will be sharing such cases. So first thing I want you all to know about the background
Sir,
is
volume बहुत low है. Can you increase?
yes, I can. So firstly, what you all need to know is that Dr. Phatak was an MBBS himself, firstly. Even if you open the repertory on the first page, he has written MBBS and not something about homeopathy to his degree.
Uh, इसमें सर
So
आपकी वॉइस स्लो है काफी.
it's on maximum from my side. I can speak loudly if you want.
Yes, sir, please.
Okay. So basically, he was an allopath who turned to homeopathy afterwards. Okay. Now, if we compare allopathy and homeopathy, allopathy is more of an objective science. जिसमें जो देखा वो सही. Okay. So it's like black and white for him. This is there, this is not there. Such simple use of rubrics and materia medica he used to do. So even as we saw in yesterday's sessions, the rubrics taken were very simple and easy to find. You don't need to interpret at all or think much on the lines of some metaphorical meaning of the symptom or rubrics. Secondly, he followed Boger synoptic key mainly to form this repertory. So, there are many pathological and general rubrics regarding that. And even if you see synoptic key or Boger or Borix materia medica, you will find that the first portion mentioned is the sphere of action or the general action of the medicine. So my today's purpose of sharing these cases is showing you such cases where I have used this approach of using Phatak Repertory. So let's start with the first case. It was a suspected case of a doctor, 31-year-old male. He was a colleague friend of mine and he called me with his agony that there is fever, there is cough, there is no chill or sweat, but there is heaviness of head and eyelids feel hot. There is weakness, cough, especially on talking. There is much pain. Pain was an intense symptom in this case. Specifically, calves pain, legs were restless with pain. Pain is constant since the beginning of this illness, and the pain is mainly of sore type, sore, bruised as if bitten. So he had already been given arnica. At times he feels that his bones are broken. His temperature was just 101, but the pulse was around 130, 150. The medicines given so far were Nux vomica and arnica, and then he had called me. Okay. Now, what I want to make you understand through this case is one learning that I had learned long back was in acutes, you need to consider generals more because generals change slowly in acute diseases, whereas particulars of the pathology changes rapidly on hourly or daily basis. The particulars, the modalities will change very soon. So it is very difficult to rely on them for prescription because it is ever changing. So what is that one symptom or symptoms that is very striking, that is very constant throughout the course of illness? That should be in my totality. Okay. Any answers?
Agonizing
If
pains.
anyone wants to participate, I'll. Yes, sir.
Agonizing pains.
Yes, sir. So one symptom that is throughout found in this case is the pain. And second thing is the objective symptom, that the fever is very low and yet the pulse is very high. That usually happens in septic fevers. So I took those two rubrics, pain in general, and under that bruised and sore, which was very marked. And then pulse out of proportion to temperature. Now, if you open materia medica, you find under pyrogen that it has anxiety and restlessness like arsenic. prostration like Carbovage, bruised soreness like arnica, which he was already given, pains and chills like eupatorium, which also has bone pains, relief from motion, restlessness of legs like rustox, and rattling of chest like entimdat, which was not in our case. But you see, pyrogen covers many medicine in its entirety. So we may give a wrong prescription out of this medicines, but if you pick the right rubrics, we came to pyrogen, and pyrogen helped the case. It was given in 200. Next case, it was a case of boils. Very small boils started occurring over entire upper and lower extremities. A young lady called up with this complaint, and she was very much troubled that she had went for waxing, and after that this started happening. Now usually we think of Bovista for any cosmetic ailment, right? What she said was that these are very small and painful to touch, and they just keep on increasing one after another. They are not going away. And this is the only detail we have in the case. So one more thing that I want to add, I think I had written this in the first slide, that Phatak repertory should be used in cases where there are very few symptoms. And this is one of that kind of case. Okay. So one thing for me here,
Boils.
yes. So I will first
Boils
open
small and sore.
exact. Perfect, that is, doctor. First rubric I need to find is boils, because that is the pathology I need to address. There is nothing else in the case beside boils. So first rubric is boils small, and this is the photo of before, this is after. Okay. You see small boils. First rubric is boils small and sore. And then what she said, बॉयल्स होते ही जाते हैं, एक के बाद एक हो रहे हैं. Boils succession of, and we know any such eruptions, be it carbuncles or anything, if they happen in succession, arnica is one of the very good remedies for that. And to our very much amazement, we know arnica for injury. Waxing led to that injury to her skin. Okay. So arnica fits very well, and she was given 1 mTDS for 1 day, and she was very much relieved and cured the next day. Okay. Third one. Now this is the case of an intern I found in our hospital. So he was roaming around with his one leg sleeve, rolled up to his knee. तो मैंने पूछा कि ऐसे क्यों किया है? And he showed me that there was this big a swelling on his uh, dorsum of his right feet, I think. And I couldn't stop but ask him कि कैसे हुआ ये? बोला मेरा बाइक स्लाइड हो गया रोड पे. Since then I am having this swelling. And he had also talked with another doctor at our hospital, and he had said कि अभी ये bruise हो गया है इसके ऊपर, so you just apply calendula ointment and it will go on its own. बट फिर होम्योपैथी का सुपर पावर हम कैसे दिखा सकते हैं कि होम्योपैथी वर्क्स वेरी वेल. So I couldn't stop but open Phatak Repertory. Tell me if you can find this amazing rubric. This is a very simple case, very, very simple case.
Sir, is it Bovista?
No, sir.
Feeling remaining after fracture or injuries?
I took very general rubric for this. So what is our pathology here? That is swelling. And what can be swelling called in general term? I usually think on the lines of our second year BHMS. The general edema. Perfect, doctor. So we will open edema rubric, and under that we find edema injury after. And there is only one remedy mentioned there, that is Bellis perennis. So I gave him Bellis perennis 30 TDS for 5 days. And he was completely better after that. And then I asked him, ki abhi you take arnica. Just as we give arnica in all cases of injury, and he had not taken it. So I asked to take arnica then. Otherwise, this swelling was almost nahi, completely gone after Balispar. Am I audible to everyone?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, Dr. Lakman, maybe there can be an issue at your end. Try using an earphone if you can.
डॉक्टर प्रजापति जी,
Yes, doctor.
आपकी आवाज सच ही शुरू से ही बहुत कम है. या तो आप नजदीक हो जाओ या कोई ऐसा साधन, क्योंकि ये नहीं है कि सब दूसरों की आवाज होगी. इट्स वेरी वेरी लो. प्लीज और स्पीक लाउडली. हमारी रिक्वेस्ट है ये.
Okay, sir. I can try to increase my volume
Now,
as
now,
much as I
now the
can.
voice is clear,
No,
sir.
it is.
या
Yeah, your
Okay,
voice is clear, sir. Yeah.
okay, okay. I'll need to hold this thing then now. Okay, but this case is clear, no?
यस.
Yes, sir.
Oh, okay, sir. So this is my last case of today's, and this is one of those case where I use Phatak for the initial times in my practice, and I was almost mind blown by it. कि मैंने कैसे ऐसे केस रेपर्टराइज कर दिया. So it's an acute case where there was early OA detected in the left knee, and patient just came for the pain and the swelling because he happened to work in hospitals and used to supply instruments. So there was lot of physical activity associated with his work, and this was disturbing his routine and his work a lot. And this is the photo that he sent me. If you can notice, you cannot properly demarcate the patella, the bone, the patellar margins that you can identify in the right knee, you cannot see very clearly in the left knee. I don't know if you can appreciate it very well, but he explained that there was some baggy swelling over his knee. Okay, so this is the picture of the previous data, and this is afterwards. Anyways, that's not important. So in his narration, he told that before 2 years, he had some incidents with his knee. He had some trouble, some symptoms, something. But uske baad, I had nothing in between for 2 years. Then suddenly 1.5 months back, he had some bike accident. Some vehicle from behind crashed into him and he happened to fell down on the road. उसके बाद भी कुछ नहीं हुआ. After 1.5 months, 1.5 months, he started having some swelling on his left knee and he went to the doctor and x-ray was done that I showed you on the first slide, okay? That there was some early OA changes एंड डॉक्टर ने बोला कि अभी हम दवाई करेंगे, अगर दवाई से नहीं हुआ तो अंदर पानी भर गया है, हमें उससे निकालना होगा इंजेक्शन से या कैसे करके. आई डोंट नो व्हाट ही टोल्ड एग्जैक्टली, बट पेशेंट ने मुझे ऐसे बोला. तो डॉक्टर हैड आल्सो गिवन हिम सम क्रैप बैंडेज टू यूज ड्यूरिंग डे टाइम, कि आपको क्योंकि वर्क करना है तो ये पहन के आप घूमते रहना. But he was nervous, so he also wore it during the night time. Almost 24 hours he used to wear the crab bandage. So इसमें इसको लेके what I interpret is that इसकी वजह से भी इंजरी हुआ है उसको. First he fell down on road, then the pressure also caused the injury in some way. Probably it can happen, no? So, and there was this modality, which is a common thing. Okay, yes, sorry. So, again, I first took the rubric or thought of a remedy that has swelling or edema. Secondly, I need a remedy that has affection of joints, right? Hello, is everyone awake?
Yes,
sir.
sir.
Yes,
Yes,
sir.
yes, yes, right. Yes.
Okay, okay. So my rubrics were dropsy, edema. Then second rubric was injury, shocks, wounds. Because I understood that injury has definitely caused some impact over his state and produced the disease. So that should be covered in the medicine. And thirdly, I went to joints, and under joints I found joints water in. And the remedy came out kali iode. Now, if we know kali iode, we know it's a very good remedy for arthritis. It and this is from Phatak Materia Medica generality. It prominently acts on fibrous and connective tissues, infiltrations, edema, chronic arthritis. Again, जैसे I told you कि probably crab bandage caused his injury and swelling. See what beauty of Phatak Materia Medica. Dropsy from pressure. We cannot even imagine this. और एक चीज पेशेंट बोला था 2 साल पहले उसको कुछ हुआ था, 1.5 महीने पहले कुछ हुआ था. अभी 1.5 महीने पहले ही फेल डाउन, उसको लेके अभी क्या होता है? जनरली नथिंग. बट वी हैव रेड दिस आल्सो इन आर्निका, राइट? But here also it's written, see, pains long after injury. You see, so Kali iode 30 I prescribed for 1 week, which helped his acute, and later on his detailed case taking was done so that this does not progress. Okay. So this is all that I had to share. Thank you.
Sir, one request is there. Please show the once
Thank you,
again.
sir.
Please show the photo of that swollen knee. I just want to add one thing.
Yes, sir. Here it is.
Sir, first, thank you for sharing the beautiful cases and the out of box thinking. In this case, what you taught us about that rib bandage was creating pressure and it may create injury. So it is out of box thinking, and good homeopath needs always to have such out of box thinking in such a cases. So guys, I just want to add one thing here, that if you look at the swelling of this knee joint, it will cover at least the size of palm. So whenever you see the swelling in larger areas around the joints especially, then Kali iodide is usually indicated. If you don't have any remedy or your indicated remedy is not working, then you can think of this clinical tip. Just consider it as a clinical tip, not as a confirmatory in each and every case. So thank you, sir. I will add one more thing. That pyrogen case was there, na? The first case, I think. So
Yes, sir.
the out of box thinking, what I was thinking in that case, that pyrogen may have worked as an intercurrent remedy in that case also. And I just want to share one thought also about pyrogenum, that whenever we are reading that pulse is out of proportion, that doesn't mean that it will be it will be have the pulse rate will have
Tachycardia.
huh, it
Yeah.
will have tachycardia. So it may be on both sides. It may be brady in spite of high temperature. It may be tachy in spite of low temperatures. So just
Right.
understand that thing. So it is the takeaway home message. Thank you, sir. In next 10 minutes, our meeting will end. I will start my case. I need to introduce myself tonight. So I have graduated in 2002 and was practicing allopathy to 2019. I was also director with a 27-bed hospital, which was running ICU and operation theaters. At that time, I was fully allopathic practitioner up to 2019. One mishap happened in that hospital, and life has turned totally. So I don't have any choice other than to practice homeopathy at that time. So I was turned towards homeopathy. I was not knowing each of the homeopathy at that time. I was not having a single remedy at that time with me. And since 2019 to 2024, I can proudly say that 90% of my practices today is of homeopathy only. And whatever I have gone name, money, whatever you can say, that is only after practicing homeopathy. So I will request everyone if some general practitioners are hearing over here, I will ask them to please get yourself converted to homeopathy. So I will share my case. So I don't have any presentation. So 3 4 days back, I received a call around 2:30 a.m. in night. The patient was the tourist in a hotel in Igatpuri. Her mother was telling me on phone, and patient was in the background. So her mother was telling that she's from a good family. They have traveled to Igatpuri from Mumbai for vacation. She has done a lot of cycling and swimming in summer under the sun. And after that, when entering the room, the room was AC. Then she bathed herself with the normal water, which generally she baths with warm water. Then they had their dinner at night, and after taking dinner, they slept. And suddenly at 2:30 a.m., she has one vomiting, and that vomiters has some what we can say, a little of blood in that vomiting. As soon as the patient saw that blood, she was gone in panic attack and anxiety. And when her mother was talking to me on phone, I can hear that she was having in lot of distress in the background, just hearing after the background noise. So I just asked her mother that can I talk to the patient? I just assured her that one vomiting with small particles of blood is not going to take your life away. So don't worry. But I advised them because she was having the chest discomfort and also abdominal discomfort. So considering her age of 22, there was very less possibility to have some cardiac ailment. But the patient was very new to me; it was not familiar to me. So I asked them to come to my clinic. I came from my home to my clinic, and then blood pressure was normal. Her pulse rate was around 120, and SpO2 was also 100%. and there was nothing which we can say that the case needs to be treated. So my first diagnosis, when I tried to examine her abdomen with stethoscope, just the slight pressure of that stethoscope, she was frightened, and she was not allowing me to check her abdomen with that one. So there was no question that I will palpate her abdomen by pressure. So abdomen was soft actually. This was the case, and whenever the time when she was on the table, examination table, she was continuously holding her father's hand, and she was in a frightened state that she will die of something. She was always telling me that डॉक्टर मुझे कुछ होगा तो नहीं ना, मैं मर तो नहीं जाऊंगी ना, डॉक्टर आप ठीक तो कर दोगे ना मुझे. So this was the case, and I don't have time to repetize the case. Uh, she was uncomfortable in lying down position, so she tried to get up from that position. And when she was trying to get up from lying down position, she was having vertigo. So that was my instant. Uh, Priorly, I was thinking of arsenic to give her because the food poisoning if I can think of, and all the anxiousness that was calling me to give arsenic. But the symptom, but the sign, not the symptom, but the sign which I have observed that she was uncomfortable from lying down to propped up or sitting position. She was having vertigo. So in one of webinar by Dr. Ellen Cancer, I have learned this thing. Also, she was when Aconite strike my mind to give, then I just hold her palms in my hand, both of the palms, and they were hot. So I have learned this thing. These two indications of Aconite from the Dr. Ellen Cancer in some of the webinar or seminar. That Aconite patient will have this thing. That patient will have vertigo, and palms will be hot. The rest of the picture was also depicting Aconite. I have just given her Aconite one and directly 2 drops on the tongue, and I just asked them to wait for 10 minutes. What happened after 10 minutes? The anxiousness, the fear of death was decreased to some extent. Then I just told her, Beta, how are you feeling? Then she just told me that she's feeling little bit better. So the remedy was right. I got that confirmation, and then I just repeated. I just put 3 4 drops in a glass of water, and again I repeated sip by sip of Aconite 1 m. After second dose of Aconite 1 m, that is water dose, she got nausea and she again vomited. Again she vomited, and after the third dose, she was feeling sleepy, and the all the symptoms were off. And the patient was with me for around 45 minutes or 50 minutes, and after that she was discharged. So I just want to let you know what's the crux in this remedy. First, I was thinking to think of the remedies which will have aggravation. What we learned in our prior. Can you guess what rubrics at first instant, according to history, I could have think at that time, apart from this anxiety and these things?
But upon it, you gave 1 and 2
Yes,
drops.
yes,
Okay.
Chilled while hot.
yes. That was the rubric I was thinking first. But when I thought what exactly was wrong with the patient. So she had all the enjoyment in sun. She has come to room. She was in AC. She has that bath with cold water or normal water. But still, she was not having any symptoms at that time. She had her dinner at normally, but at the time of 2 a.m., which is the time Dr. Ellen Cancer in one seminar said that he was prescribing arsenic album if patient he thinks not prescribing, he thinks arsenic album if patient calls in at night between 1 to 2 a.m. He will just look at the watch, look at the clock, and he will think of arsenic to be one of the remedy. So we need not to go in each and every case. That patient will tell you the exact time that we need to understand at what time patient is falling. If gastric trouble are coming in that time, then arsenic is the first remedy. I could have thought at that time, but I have given her aconite, and aconite solved the case only. But I have repertorized this case when I given her aconite, a dose of aconite 1 m. Then I got the time to repertorize this case. So the problems with the patient started after seeing that blood which was there in vomitus. So it was not the problem which we were thinking chilled when heated. So we need to think the exact cause. So the first rubric was S shocks mental. Then she was telling me that she needs to get recovered very fast. So carried wants to be fast. Aconite is also there in Phatak. Then pulse was 120, so I took pulse rapid, quick, too fast. Then fear, anxiety, fright. Then fear, death of. Then all of this was started suddenly. So what rubric we can think? We need to join this meeting again for 10 minutes. I need to talk on my medical.
Sir, can you repeat the rubrics, please, again?
Okay. Shocks mental.